Hello friends, welcome to my class today. Today we'll be seeing the procedures. So in the nursing foundation, the first year procedure, that is bed making. Okay, so as per one of our subscribers request, I thought of doing the bed making procedure. So Miss Sanju, she asked me to do the to do some procedures in the first year topics. Okay, so today we'll see bed making. So first of all, bed making means it is the procedure we do in order to maintain the cleanliness of the ward and the environment. Okay, so that is nothing but we put the sheets in an orderly manner on the bed so that the patient, whenever he is coming, he will be comfortable and he has an aesthetic effect when he enters the hospital. Okay, so patient is the guest, and whenever any guest is coming to our house, we make the house neat and clean. Same way, when patient is coming, patient is the guest for us, so we have to make the bed clean and neat so that he will be comfortable when getting admitted. Okay, and purpose of bed making is, so as I already said, it is to give a aesthetic effect of the environment, and next is to make the environment clean and neat so that the patient will be comfortable when he is coming and getting admitted in the hospital. And moreover, germs are found everywhere in the environment, and also in the bed. Maybe some patient would have slept and gone, so the patient, we have to prevent cross infection, that is we have to prevent the infection of the previous patient to the new patient, so that we have to clean the bed and make the bed neat so that the patient will have a good comfortable stay in the hospital. And coming to the principles of bed making, so whenever we do any procedure, we have to see that we always stand in the right hand side of the patient. Okay, so right hand side of the patient, so that is the area, right side, it is very easy for us because always dominant hand is on the right side and it is easy for us to do the procedure. So always you have to see the that we are in the right hand side of the patient. Okay, and always we have to clean from the cleanest area to the less clean area. Okay, so this is the head end of the bed. Head end is always the more clean, that is cleanest area, and the less clean is the foot end. Okay, always when you are doing any procedure, always go from the cleanest area to the less clean area. And next is simple to complex. Okay, so first do the simple procedures and then go to the complex procedures. Okay, that means all the things which are nearby we will be first doing, and then we have to go to the complex area that is very far to our place. Okay, so you have to always remember simple to complex, and whenever we have to do any procedure, we have to know the anatomy, physiology, and all the microbiological effect, everything we have to learn so that we will know about all the systems, how it is functioning for the patient, and any procedure we must be aware of all the anatomy, physiology, and microbiology. So in microbiology is nothing but there is so many germs in the environment, so we must make the environment clean before admitting the patient in the hospital. Okay, so whenever we do a bed making, first we do a carbolization procedure. Okay, so carbolization is another topic I will be teaching in the next classes. Okay, so we need some chemicals. So due to unavailability of the chemicals, I will take it in another class. Today we will see the bed making procedure. Okay, so there are so many types of bed. So first is the open bed. Open bed is done for that is when the bed is empty and we are waiting to receive the patient from the admission area. Okay, so when any patient is newly admitted in the hospital, we make the bed ready and we receive the patient, that is called as open bed. It is also called as unoccupied. Okay, there is no one, so unoccupied bed. And the next one is closed bed. So it is also called as occupied bed. So this bed we make every day for the patient. Mostly when the patient is unconscious or he is not able to mobilize from the bed, any conditions where the patient is bedridden. So when the patient is on the bed itself, we have to change the linens for the patient, linen and sheets for the patient. So that is called as the closed bed. Okay, other than this there is also cardiac bed. So cardiac bed is for any patients with respiratory or cardiac problem where the problem is there is difficulty in breathing, then in order to rest the patient hand on the cardiac table, or if the patient want to feed, we can give the food in the cardiac table. Okay, so cardiac bed is nothing but there will be an extra cardiac table. And next is the post-operative bed. Post-operative bed is the almost the procedure is same, little different in the top sheet, and also we have to place the hot water bags on the bed, because in post-operative that is the patient coming from the operation theatre will be in a very cold area. Okay, so operation theatre is a cold area, because to prevent infection they maintain the area very cold. So patient is coming directly from the cold area, so the bed should be little warm for him so that he may feel comfort. So we will keep some hot water bags and warm the bed before the patient is coming. That is called as the post-operative bed. Okay, and other than this there is also cradle bed. Cradle bed means we keep a cradle on the bed so that there will be two top sheets used which will be closing the cradle. This is because this is done for any burns patient, amputation patient. So anywhere where the skin, where the bed sheets, that is linen, should not directly touch the patient's body. Okay, at that time we use this cradle bed. Okay, and otherwise there are fracture bed where is used in the orthopedic area. So here we will keep some splints that were ready for the patient, because patient, we don't know what type of fracture. So according to the types of fracture, patient may need a splint. So as per the need, we have to keep the splints also on the bed. Okay, so these are the types of bed. So today I will be dealing only with the open bed. Okay, so before going to bed making, that is, we must know what all the articles needed. Okay, so for bed making we need a cot and a bed, and then we have to have a bottom sheet. Okay, and so there is a bottom sheet and a Macintosh or a rubber sheet. Okay, so this to prevent the soiling of the bottom sheet. And then we need a draw sheet. Okay, so draw sheet is nothing but half size of the bottom sheet, that is half size of full sheet. This is to cover the Macintosh or the rubber sheet. And next we need a top sheet. This is to cover the patient. And then we need a blanket. So this blanket is used when the patient is living in a cold area, or if the room is air conditioned and it is very cold, so patient may need a blanket. And we need a pillowcase. So this is to cover the pillow, and we need a pillow. Okay, so according to the needs of the patient, we can also add extra pillows. Okay, whenever we are keeping the articles ready, so we must also keep the bed sheets folded. Okay, and there is a procedure for folding the bed. Okay, so this is called as bottom sheet. Okay, bottom sheet is which is directly in contact with the bed. Okay, and this bottom sheet, when you are folding, you must always see, so this is the correct side and the stitching side is the wrong side. Okay, so always this, so the correct side and the wrong side, always the wrong side should be coming up. Okay, and when you fold also, you have to fold only half like this. Okay, and the wrong side should come up. Okay, so if you have some helper, you can tell the person to catch the other side and you can fold it like this. Okay, so always see half of the sheet is covered like this. Okay, and next the remaining half you will be covering like this. Okay, so this is how you will be folding and coming when you make the bed. Okay, and same way you have to make a 3 folds. So that is first fold, and this side. Okay, when someone is helping you, it will come neat. Okay, so this is the second fold and this is the third fold. Okay, so like this. So according to your convenience, you can keep like this, or you can also make another fold. But remember, bottom sheet, always the wrong side should be coming up. Okay, and Macintosh. So again in Macintosh, you should see that the wrong side. So this is the correct side and this is the wrong side. So you have to make fan folding like this. Okay, so this is called as fan folding. And next is draw sheet. Okay, so draw sheet means half of the full sheet. So there is no draw sheet with me, so I am showing the full sheet itself in half. But make sure draw sheet is also folded like the bottom sheet. Okay, so that means you have to fold the wrong side up. Okay, so draw sheet also wrong side up, but I have the same sheet, so here both the sides are clear. Okay, so it is both the sides are correct, so I am using this. Okay, again this also I will be folding half and half. Okay, so here half like this and this half like this and the remaining half like this, and then it should be folded like this. But remember, draw sheet is upside down. Okay, when you fold the top sheet, so the top sheet you must remember the wrong side should come inside and the correct side will be coming on the outer area. Okay, so the folding is same. Half of the sheet you will be folding like this. Okay, the other half you will be folding like this. Okay, and the remaining half like this. Okay, so make sure it is clean, so neatly folded, so you can take the help of some other person also. Okay, so neatly you have to fold it. Okay, so again three folds, so one fold this side and one fold this side and one fold here. Okay, so always make sure no sheet or anything should touch your body. Okay, next is the blanket. So blanket is also same as that of the top sheet. Okay, so that is the wrong side will go inside and the correct side will be coming on the top. Okay, so procedure everything is same. So like this you have to fold it. Okay, again three fold this side and also this side and make it like this. Okay, so all these foldings you should be doing in the utility room itself, so don't do it on the bed. So because there is no assistance, so I showed it on the bed, but usually this folding you can take a help of someone and then do it on the utility room. Okay, and then you have to fold it like this and bring the all the sheets to the bedside and make sure the bed is carbonized neatly with any disinfectant solution. So carbonization procedure we'll see later, and then go and wash your hands and come. Okay, so any procedure when you do, you have to wash your hands. Okay, so there is also so many steps in hand washing, so that is also another procedure we'll see. Okay, then go and nicely wash your hands and come, then you have to start the procedure. Okay, so you must take precaution that your body should not touch the bed, and always you should maintain a distance from the bed and your body, at least 2.5 inches you should be far. Okay, and another principle is always you have to finish at the head end, that is cleanest area, then you will be coming to the less clean area, and make sure you are on the right side of the person. While doing the procedure, so put the bed sheet like this in the middle and make sure the head end you will be having more. Okay, so put it like this, and head end the sheet should be more than the leg end. Okay, so you will be putting in the middle like this and then remove the folds like this. Okay, and then always see that you finish the head set. Okay, so once you put, so you have to take the bed like this and then make a mitten. Okay, so you will, with the corners of the sheet, you will pull it and then you will have the triangle like this. Okay, so then you have to take it up, put it like this, then you will tuck this one. Okay, always when tucking, the palm should see down. Okay, palm of the hand will be down, dorsum will be up. Okay, so put it like this and then the remaining sheet you will be tucking like this. Understood? So here you can see the mitten. Okay, so this triangle area is called mitten. So you will be tucking like this. Okay, so always first finish the head and then go to the leg. Okay, and now you will be tucking the middle area like this. Okay, and then you unfold all the sides like this and leave. And next you have to use the Macintosh. Okay, so when putting Macintosh, you can put at the farther end and you can pull it like this. Okay, so this is the Macintosh, and next you will be putting the draw sheet. Okay, again draw sheet, you can put it in the middle like this, then remove. Okay, so always put it in the middle. Okay, and then you can, and one end you will be tucking. Okay, so finish the area where you are, then you can go to the other side. Okay, so like this you will be tucking. So finally we will be putting the top sheet. Okay, so top sheet same way, keep it in the middle. Okay, so open it like this and then open on the farther side, then on the nearer side. Okay, so you have to open it neatly. Okay, then you have to use the blanket. So blanket and top sheet you will tuck it together. Okay, see that the blanket and the top sheet are same. So okay, so put the other side this side and this one. Okay, so you have to make it like this. And now tuck the top sheet and bottom sheet together. Okay, so you have to tuck it together. Same way as I said, the corners you have to catch like this. Okay, so take the bed up, pull the corners neatly, then the middle of this you will be doing like this and tuck it like this. Palm of the hand should go down and the remaining, so you can see the mitten. Okay, so this shape should come when you tuck the sheets. Okay, so okay, and the head end, okay, this end will not be tucked. So with the sheet and the top sheet you will do it like this. Okay, so they make a three-fold. Okay, so one. Okay, so you will be folding like this and then again like this. Okay, and the remaining this you will be tucking. Okay, so finish this side, then go to the other side. Okay, so when you come to the other side, so first finish the head end. Okay, so okay, same like this you will be making three folds. Okay, and then tuck this area. Okay, same way, catch all the sheets, pull it inside, and the middle area you will take like this, and the other area you will be tucking, and then remaining. Okay, so this sheet is small, so you have to tuck it. Okay, so this area, okay, so there are different hospital policies. So you can leave it like this, tucked, so that when the patient is coming, just you will be removing the bed like this and you can receive the patient. Or in some hospital, okay, so they do another folding like this. Okay, in some hospital, they also make a they make a triangle fold like this. Okay, in some hospital they make a triangle fold like this, so that patient can come, and when the patient is coming, he will be coming like this and he will go inside the bed. Okay, so this is how you will put the bed making, and finally you have to use the pillow cover. Okay, and always pillow cover when you are using, see it is not touching your body, and you have to make the pillow cover half like this. Okay, so when you are so put your hand inside and make the pillow cover half. Do not touch the outer area now. Okay, so make the pillow cover half, then take the pillow and put it inside like this. Okay, so then it's easy for you. Now you can, just you can half area you can unfold it like this. Okay, and when you are keeping the pillow, okay, so the pillow has to be, so this is the mouth end of the pillow, so the open end of the pillow should be away from the patient side. Okay, patient will enter through that side, so you have to keep the pillow open end in the another side. Okay, so this open end should not face the patient side. Okay, so this is about the open bed. I hope you would have understood. So any doubts, any queries, suggestions, you can please comment below, and if you are interested, please like, share and subscribe and click the notification button for daily updates of my video. Thank you so much.